How common is testicular cancer recurrence after early treatment? Imagine going through treatment for testicular cancer and wondering what the chances are it might come back. Well, the good news is that recurrence after early treatment is relatively uncommon, but it's not impossible. The likelihood of the cancer returning depends on several factors like the type of cancer, how advanced it was, and the treatment approach used. Studies show that about 10 to 30% of people with testicular germ cell tumors experience a relapse after their initial treatment. Most of these recurrences happen within the first 2 years, which is why doctors focus heavily on close follow-up during this period. In fact, around 70 to 75% of relapses occur during this early window. If the cancer does come back, it's often in the retroperitoneal lymph nodes, which are located in the abdomen, rather than in the remaining testicle, because the affected testicle is usually removed during initial treatment. Late relapses, which happen more than 2 years after treatment, are much less common. They occur in roughly 2 to 3% of cases. Very late relapses, even decades later, have been reported but are rare and usually requiring personalized long-term follow-up. This means that even after successful treatment, some individuals may need ongoing monitoring to catch any potential recurrence early. For those diagnosed with stage 1 testicular cancer, where the cancer is confined to the testicle, about 1 in 4 patients might experience a relapse within 5 years if they are managed with surveillance alone, meaning no immediate additional therapy. The good news is that most relapsed cases can be successfully treated with chemotherapy or radiotherapy, leading to cure rates close to 100%. The risk of recurrence can also depend on specific tumor features, such as whether the cancer is seminoma or non-seminoma, the size of the tumor, and whether it invaded nearby structures like the reedy testis. These factors help doctors decide on the best follow-up plan but are not perfect predictors. It's important to remember that recurrence is not the same as developing a new cancer in the opposite testicle or other organs. Those are considered second primary cancers, which are separate from a recurrence. Because of the possibility of late relapse and the risk of secondary cancers, long-term follow-up tailored to each individual is recommended. This usually involves regular physical exams, imaging tests, and tumor marker tests to catch any signs of returning cancer early. Overall, the outlook for testicular cancer is very positive. Most patients do well with proper treatment and follow-up. If you or someone you know has been treated for testicular cancer, it's essential to stay in touch with healthcare providers and follow their advice for ongoing monitoring. This approach helps ensure that if a recurrence does happen, it can be caught early and treated effectively. Remember, every case is unique, so personalized medical guidance is always the best course of action.